Can high HPV vaccine rates really stop reproductive cancers? Imagine a simple shot that could significantly reduce the risk of some of the most serious cancers affecting the reproductive system. That shot is the human papillomavirus vaccine, and it plays a crucial role in preventing cancers caused by high-risk types of HPV. Human papillomavirus is a common virus, and certain high-risk types like HPV 16 and 18 are responsible for about 70% of cervical cancers. Vaccinating against these types can dramatically lower the chances of developing these cancers later in life. Cervical cancer is the most well-known and preventable reproductive cancer linked to HPV. Countries with high vaccination rates have seen a sharp decline in cases, especially among women vaccinated before exposure to the virus. Studies show that women vaccinated at a young age, before becoming sexually active, have nearly eliminated their risk of developing cervical cancer. This is because the vaccine is most effective when given before any contact with HPV. It is recommended for adolescents around ages 9 to 15, with the goal of protecting them early. The vaccines available today protect against multiple high-risk HPV types, not just HPV 16 and 18. Some newer vaccines cover even more types, which means they can prevent a larger percentage of HPV-related cancers. When vaccination coverage is high across a population, the overall amount of high-risk HPV circulating decreases. This means fewer people are at risk of infection and, consequently, fewer cases of HPV-related cancers develop over time. While cervical cancer is the most directly impacted by HPV vaccination, it also helps reduce other reproductive cancers. HPV is linked to some penile and anal cancers, and vaccination can lower the risk of these as well. However, testicular cancer is not caused by HPV, so the vaccine does not prevent it. Testicular cancer has different risk factors and is not related to viral infections. In summary, increasing HPV vaccination rates can significantly reduce the number of reproductive cancers, especially cervical cancer. The key is to vaccinate early, ideally before any exposure to the virus. Even vaccinated individuals should continue regular screenings because the vaccine does not protect against all high-risk HPV types. For other reproductive cancers, vaccination offers clear benefits where HPV is involved. Always talk to a healthcare professional for personalized advice about vaccination and cancer prevention. And remember that combining vaccination with regular screening is the best way to protect your health.